Okay, you guys watched my last video, and I really appreciate that. And if you watched it, that means that you kind of understand this stuff. So let me just go through some stuff and answer some questions that I had that came up out of that last video. Magi, that's my dog. Come here, Magi. Let me say hello. And we're fixing to go for a ride. And I just stopped here to talk to you because this Jeep is not built for smooth riding. It's built for climbing things. So it gets real jittery when I try to talk while I'm riding. So anyway, the questions that I had on that last video were that number one, what about the big stuff? We had several people that asked about the big stuff, heart attack, stroke, renal failure, organ transplants, things like that. I mean, or just everyday, big stuff like you have to have surgery or you get in an accident that costs a bunch of money or whatever. And let me tell you, there's a lot more to it than even that question. And I'll answer that question, but I'm gonna delve a little deeper into it. The question that I have to people, number one, yeah, you got to worry about the big stuff, and that's the only reason for having insurance at all. You don't buy insurance to protect yourself against the things that you could afford to pay for without insurance. You go do the direct primary care and the prescription drug, GoodRx and things like that, and I've got a whole lot of other tools that I can teach you. But as far as that, to answer that question, here's the thing: is that you've got several things that might happen to you. Number one, you could die too early and not have any health issues in your lifetime, but you died too early and you left your family without your income. I mean, and number two, you could get hurt or sick and heart attack, stroke, things like that, and then you can't work, or you get in an accident of some kind, not just a car accident, but just falling off of a ladder or something, and hurt yourself and can't work. And what do? So many people, they spend all of their money on major medical coverage, Obamacare. Obamacare is taking up all of the air in the room. There's no money left for the things that people really need. If you don't have an income, your life falls apart. The most important thing is your ability to earn an income. If you lose your ability to earn an income, everything else falls apart. Everything else is stacked on your ability to earn an income, your lifestyle, all the things that you want for your life, the things that you want for your family, your kids to be able to go to college, your retirement plans for your for yourself and your wife, and to be able to travel and just live the lifestyle that you want to live in a nice house, drive nice vehicles, things like that, whatever. I don't know what your goals are in life, but all of that is stacked on your ability to earn an income. That holds up everything, and people forget that's what holds up everything. And so you want to protect your ability to earn an income first, number one, because if you die too early and you're not there to bring in that income for your family, are your kids going to be able to go to school? Is your family going to continue to be able to live a decent lifestyle, the dreams that you had for your family? I mean, that's important. Or you could just become disabled and not spend a whole lot of money on health care, but you could become disabled. Or you could become disabled and spend a whole lot of money on health care. Or you could not do either one of those and just be healthy all of your life and never spend any money on health care. You end up living too long and you outlive your money. And so you plan for retirement and things, and you have maybe a 401k or whatever, and you end up living way too long and not spend it on health care, but you end up running out of money when you get into your old age. Or you don't live, you have a major health issue, and you can't care for yourself. You can't bathe yourself and dress yourself and all of those kind of things. What are you going to do? If the only answer to that, unless you have a wife or a husband or whatever that's a nurse, or that can lift you and carry you around and move you around and things like that, that puts a major burden on your spouse. And so the one thing that you could have is long-term care insurance. But if you don't have that, what are you going to do? If you have it, people worry that people are going to be put in a nursing home or things like that. That may be the only thing that keeps you out of a nursing home. It would afford your wife or your husband the ability, that person, to be able to bring a caretaker into your house, to be able to pay them to bathe you and dress you and feed you and do all of those kind of things. I know that's not something that you want to think about right now, but these are actual issues that happen to people's life that have nothing to do with paying for a doctor's office or paying for a hospital or paying for a prescription drug or something. And to put together a really solid plan to do all of that requires some thought. The answer is there's some tools that you can use, and then I'll tell you some of them that you can look into. What I would do is a indemnity type plan, a good one. Number 2 is a umbrella policy to go over the top. And the way I would do the umbrella policy, you could do it with a short term, but then you got all the problems that I told you about with the short term. Or you could do the Christian Sharing Ministry with a high deductible. Now, they don't call it a deductible. They call it an annual share or something like that. I'll have to look it up for you. But get one with a high deductible. You don't want to dip into that sharing ministry thing unless you really need it. You just want it to be there to cover the bigger ticket things that if something were to happen to you. And then last but not least is an indexed universal life. These are products, you don't think about these, but you realize that a good indexed universal life is going to have long-term care coverage in it. It's going to have critical illness coverage in it. A good indexed universal life is going to have that kind of stuff in there in it too, and help you if you live too long to make sure that you've got the cash and an income to continue that in there. It's that package, a good indemnity plan, an umbrella policy over the top, and an indexed universal life. With all of that, and you can have coverage for everything I just mentioned, all of the things that I just talked about, all of the problems that would be solved with that package right there. And you can do it for a family of 4, a 35, 40-year-old husband and wife and a couple of kids. You could do all of that for less than $500, where it would probably cost you $1,500, like I talked about in the last video, if you did it with just Obamacare, and you wouldn't get all of the other stuff. So anyway, that's my rant for today. I'm sorry. I just wanted to answer that one question. I'll do some other ones to answer the other questions that came up, and I didn't want to make this one too long. This one's already fairly long. So anyway, thank you for watching. Have a great day. I'll talk to you later. Bye.